For hundreds of years, we have sat passively in lecture halls and been talked at. That actually doesn't work very well to get people to learn new things.
So our class, the Design for Care workshop, addressing healthcare challenges with design thinking, aims to change this.
The vision of the design program is to provide credit-bearing courses for any student on campus from any discipline, undergraduate or graduate, to come engage on interdisciplinary teams to do project-based learning and apply all the disciplinary knowledge they've gained in their own fields to the challenging problems that we face in the healthcare space.
You have your set of unique experiences and your ideas, but often it's hard to piece them together to a solution. And you're just missing components of this puzzle where you can continue guessing, but when you talk to other people, they're going to bring this entirely unique perspective.
The beauty of real world problems is they're messy and there is no one right way to solve those problems. So you really do get to bring your own perspectives and creativity.
We did a fun brainstorm for the COVID-19 pandemic of what's another way that we could get vaccines into people. And we're kind of yeah, it has to be an injectable. And Brian's over here going, well, what if it's an edible? Or what if it's something that you inhale, like the nasal flu shot? None of us thought of that, and then he did. So that was one of the best instances where he has a totally separate background from the rest of us and thought of these different issues.
For example, if there's an assignment that requires multiple perspectives, one of us will take the patient's perspective, the other one will take the physician's perspective. How does this treatment, for example, integrate, and how does it appear to both of these different groups?
Really digging in and giving them the space to do that work, you could see them start to kind of have these little aha moments.
It's also really exciting too. It gets you thinking a completely different way, in a different level of abstraction. It's hard to lead yourself to that point by yourself.
Collaboration, creativity, thinking out of the box. What would you create in that space where you are unlimited?
I'm very much is it feasible or not kind of person. So something that's really hard that Dr. Casey worked on a lot was to not immediately latch onto a solution.
You don't have to enter the design thinking process at the beginning. It's not a rigid checklist of things that you do. It's really meant to be a mindset. Another resource that we're going to be building out is the makerspace. The act of making something physical makes it easier for other people to see it and give feedback. We don't have 3D printers yet, but we're working hard to provide a lot of prototyping tools in the future. So during class, as we work to prototype, we'll be able to just walk into the makerspace and 3D print something, or use the laser cutter or the sewing machine or the cardboard and Play-Doh to do kind of lower resolution prototyping. Really, at the end of the day, the program is meant to produce a body of students who have experience and competence in going out and making the world a better place.